Yesterday, while I was reviewing local TV news reports in Iowa, because that's kind of what my days are like now, yesterday I came across something that I thought was a little bit weird in the local news about the city of Perry, Iowa. Perry is Dallas County, Iowa. It's northwest of Des Moines. It's right on the North Raccoon River. It's a small place. Less than 8,000 people live there. It's got one high school, one hospital, one big employer, which is a Tyson plant, a meat processing plant. As I mentioned, Perry is only a town of about 8,000 people, but more than 1,200 people work at that one plant. So you can imagine how dominant it is in terms of what happens in that town. Well, over the past few days, the mayor of Perry, Iowa, and other officials in Perry have started speaking out about their concerns that they haven't had any idea what's going on with coronavirus at that Tyson plant. They had been told, yes, the plant has some positive cases, but the plant wouldn't specify how many, and it wouldn't say anything more about how serious the problem was at that place. And as you can imagine, in a town that small with a plant in it that's that big, the size and characteristics of the outbreak of communicable disease at that plant is the kind of thing the town actually would need to know.
We would like to have the numbers so we know what we're dealing with, and so the citizens of Perry could know what they're dealing with, and so we could all react accordingly.
That's an interview with the mayor from the town of Perry. That was done by KCCI, local station there. The station also reported that the town couldn't even figure out why the plant won't tell them how many workers are positive there. So that's an interesting thing. But then the local TV station, KCCI, looking into this, trying to figure out why local officials can't figure out how many employees are infected at this plant, why the plant won't say anything. They then got this piece of information, which I think is truly odd. I have spent the last few weeks marinating in local news coverage from all over this country. I have never seen anything like this anywhere else in the country. Watch.
Right now in Perry, it is still unclear just how many cases of COVID-19 there are at the Tyson Foods plant. Last night, KCCI told you about our push to get answers. Neither Tyson Foods nor Dallas County Public Health will tell us how many cases there are at the plant until 10% of the workforce tests positive.
Until 10% of the workforce tests positive. They will not tell us how many cases there are at the plant until 10% of the workforce tests positive. What's that? What's the magic threshold that you cross where the town mayor, where your plant is only allowed to know how many people have coronavirus at the town's largest workplace once 1 in 10 of the people there is infected? But before then, he's not allowed to know. Nobody's allowed to know. What is that? I mean, in a public health apocalypse, the higher, cooler rings of hell are for bad and counterproductive policies that aren't based in science, right? That aren't based on actual public health imperatives. I think there's a slightly deeper, slightly hotter ring in hell for policies that have random numbers stuffed into them to make it seem like they're based on something derived from numbers, like, for example, math or statistics or some kind of science. But actually, it's just random numbers inserted into a policy, and the policy is just your usual trash. But that's apparently what has been in effect. The Tyson meat plant in Perry, Iowa wouldn't tell the town of Perry, Iowa how many cases it had in the plant there until a magical 10% infection rate was crossed. So that's what Perry officials have been waiting on. While not incidentally, the Iowa governor, Kim Reynolds, has been bragging about how awesome Iowa is doing with this whole coronavirus thing, and it's time to open everything up again because everything's fine. Governor Reynolds literally signed on to this op-ed today with 4 other Republican governors. Our states stayed open in the COVID-19 pandemic. Here's why our approach worked. Well, here's how it worked in Perry, Iowa today. Lucky for the town, in terms of knowing what's going on, the plant in Perry, Iowa, the Tyson plant there, did hit their magical 10% threshold. And so now the plant has elected to disclose to the town exactly what kind of coronavirus problem they've got in that gigantic workplace. Here's how the very, 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 very local newspaper, Perry News, headlined it today. Quote, jaw-dropping 58% of Perry Tyson workers test positive. There are 1,250-ish workers at the Tyson plant. 730 of them have tested positive. That's 58% of the workforce in that plant. I mean, there's a Tyson plant in Waterloo, Iowa, with over 400 cases. That has produced over 1,500 cases in surrounding Black Hawk County. It has produced absolute despair among their overwhelmed local officials and hospitals. There's another Tyson plant in Columbus Junction, Iowa, that closed because of some indeterminate number of cases, and the state and the plant wouldn't talk about it for weeks. Well, the state now says it was over 220 cases at that one plant in Columbus Junction, but now it's 730 cases among workers at that one plant alone in Little Perry, Iowa. Spare a thought for Perry, Iowa, and its one hospital and what they're about to go through in Dallas County. If you want to watch for them to appear as the next spike in American coronavirus outbreaks, they will probably be listed as Dallas County, Iowa. Watch for that. And then in a couple of days, you should watch for Madison County, Nebraska, to become another nationally discussed spike, because the Tyson plant there just closed as well after almost 100 workers tested positive. The test results for more than 1,000 of the other workers in Madison, Nebraska are due to come in tomorrow or Thursday, so brace yourself for whatever those numbers are going to be as well. The reason I spend my days now reading like the Perry, Iowa News and the business pages in Nebraska is because I feel like it's my job now, bottom line, and it's hard to say, but bottom line, I feel like my job right now is to try to get my head around how many tens of thousands more Americans are going to die from this thing, in large part because of the way our country is botching the response to this epidemic. And in order to do that, you have to look at the Perry, Iowa News and the Nebraska business pages, and everywhere else this thing is blowing up. And I know I'm supposed to cover politics here too. That's part of my job. But I actually can't fathom the politics that would lead a governor like Kim Reynolds in Iowa to brag about reopening her state right now, this week, as the state crosses 10,000 cases and starts turning up 200, 300, 400, 700 plus cases at individual workplaces, including in small towns that only have one hospital. And I mean, it's not just Iowa, right? I'm sure there's politics that explain why Texas is so excited to brag on how it's opening up whole new categories of businesses statewide on the same day that Dallas, Texas announces its highest number yet of new cases. I mean, I'm sure we will look back at this moment and there will be a clear, in hindsight, political explanation for headlines like this. The U.S. just reported its deadliest day for coronavirus patients as states reopen. I mean, the president today decided the stay-at-home order isn't working for him anymore. He's got ants in his pants now. So he flew out to Arizona for a photo op at a mask factory where he didn't wear a mask. And he did so on the day that Arizona announced its highest daily death toll yet. Why are we opening things up when the epidemic is getting worse? Why are we opening it up specifically in states where cases are going like this? Right? The American epidemic overall has ballooned to over 70,000 dead now and over 1.2 million cases among Americans. And yeah, you have to use a wide-angle lens. You need to look in places you don't usually look for big national news stories right now in order to actually characterize what's going on and what's going so wrong in this epidemic and in the public policy response to it. You have to use a wide-angle lens. To look in these places, you don't usually find big national news stories. But if you look there now, you will find what amounts to the biggest story on earth. And actually, to their credit, I think the New York Times nutted it up elegantly tonight in what will likely be a landmark front page story for them. One that finally, I think at least, gets the headline right in terms of providing a reality check antidote to the happy talk from Washington and from, increasingly, Republican governors around the country. Here's the headline: Coronavirus in the U.S., an unrelenting crush of cases and deaths. And here's the nut graph. Coronavirus in America now looks like this. More than a month has passed since there was a day with fewer than 1,000 deaths from the virus. Almost every day, at least 25,000 new coronavirus cases are identified, meaning that the total in the U.S., which has the highest number of known cases in the world, is expanding daily by between 2 and 4%. That is very bad. Quote, rural towns that 1 month ago were unscathed are suddenly now hotspots for the virus. It's rampaging through nursing homes, meatpacking plants, and prisons, killing the medically vulnerable and the poor and new outbreaks keep emerging in grocery stores, Walmarts, or factories, an ominous harbinger of what a full reopening of the economy will bring. While dozens of rural counties have no known coronavirus cases, a panoramic view of the country reveals a grim and distressing picture. Quote, if you include New York, it looks like a plateau moving down, says Andrew Neumer, an associate professor of public health at UC Irvine. But if you exclude New York, it's a plateau slowly moving up. And then the Times, in their data visualization department, they do that work to show you what that looks like. Right? On the left, that is the comforting graph shape we are also used to seeing by now. That is specifically the New York metropolitan area. And that is a terrible thing, right? That represents thousands of cases. And as we know, thousands of deaths. And that curve isn't coming down nearly steeply enough, but at least it's coming down convincingly. That's New York on the left. On the right, that's what's happening in the overall American epidemic if you drop out the numbers from the New York metropolitan area. Up, 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 keep going up. The New York metropolitan area got its gigantic epidemic under control at the cost of 25,000 dead New Yorkers, among other things. But they got it under control. The rest of the country is ascending relentlessly. But for some reason, the way our politics and our brains are working right now, we think we're doing great. As if the whole country is New York. Right? I mean, we think we're doing great. We're past all this. Time to stop working on it. Turns out it's no big deal. Why are our brains and our politics working that way right now when what we're going through as a country right now is an exploding epidemic that is getting worse? I mean, in Hartsdale, Tennessee, Trousdale County, Tennessee, we have talked in the last few days about the testing they just did there of the men who are incarcerated in the state prison they've got there. They turned up more than 1,200 positive cases among the prisoners at that facility in Trousdale County, Tennessee, plus dozens of staff members. There's only 11,000 people in the whole county. So the space of a week and a half, that little county went from 27 known cases to more than 1,300 known cases. How have they responded to that this week in Trousdale County? They've decided to open back up all the businesses in the county this week. And they went from 27 to 1,300. That's this week. And so they're celebrating by opening up all the businesses. Because why not? Why were they closed anyway? Everything should be fine. Where do you think the people who work in that prison go home to after their shifts? The disconnect between what is happening in the epidemic and what decisions are being made now about whether or not it's over, ollie, ollie, I'll come free, is a disconnect that reflects something about American politics. It's a disconnect between what a bad situation we're in and what kinds of decisions we're making. That disconnect, honestly, reflects a country with bad leadership, with bad politics that aren't correcting bad decisions at a critical time. I mean, when you're talking about decisions for the country that'll either kill tens of thousands of Americans or keep them alive, those decisions should be based on a realistic perception of what's actually happening in this crisis. But instead, we've got, headlines every day that look like this. Trump cheers on governors even as they ignore White House coronavirus guidelines in race to reopen. Right? We've got these White House guidelines, supposedly President Trump's own guidelines, that say states shouldn't open up until, among other things, they've got 14 straight days of declining cases. The American states that are right now opening up, by and large, do not have anywhere near that. Because the American epidemic is getting worse, not better. But whatever. Who said he cared about his own guidelines anyway? Why did they even issue them? In Sioux Falls, South Dakota, they have now reopened the big Smithfield meat plant there. That was the direct source of more than 1,000 coronavirus cases in Sioux Falls. They reopened that plant yesterday despite all the people who have already gotten infected there. They reopened it yesterday without testing all the employees who were going into the facility for the reopening. Instead, they decided they would just scan all the employees to see if they had a fever on their way in. Well, what does that do? If you have COVID-19, but you're not symptomatic, you don't have a fever, you can still spread the virus to others. You're still infectious. So scanning for fever, yes, it might identify individual people who are already sick, which is a nice thing, I suppose. But when it comes to actually trying to keep COVID-19 out of that facility so hundreds of other workers there stop getting infected on the job, scanning for fever at the gate is nothing. Scanning for fever at the gate is what we used to call security theater. It's nonsense designed to make you feel like you're doing something to keep yourself safe, even though you're not. It's like if you were trying to keep everybody under the age of 18 out of your venue, so you put up a sign that says, you must be this tall to enter. Like, okay, maybe you'll catch some, but tall kids will get in fine, and short adults will be excluded. You're scanning for something, you're testing for something that isn't actually determinative of the thing that you are looking to exclude. Why would you do this? Why would you allow the reopening of this plant without testing everyone? This is a plant that's already led to more than 1,000 infections. Why would you let them reopen without testing everybody? Oh, turns out there's an answer to that.
One of the most effective things that we can do is test Smithfield employees to make sure that they are COVID negative before they're going back into work. We also want to make sure that their family members have the opportunity to be tested. This event is optional for Smithfield employees and is not a requirement for them to return back to work.
Whose decision was it to make the testing for employees at Smithfield optional and not mandatory for returning to work?
That decision was made by Smithfield as the employer.
Okay, thanks.
Okay, thanks. That's the state health director and the governor of South Dakota saying basically, yeah, it would be really important for everybody to be tested before they go back to work in that plant that's already given us over 1,000 infections in Sioux Falls. But yeah, as much as we want that, the plant's reopening and the testing, it's optional. Might happen, might not, because the meat company, Smithfield, decided that they didn't want to test everybody before they reopened. How can that be? That the company just decides and the state is like, oh, okay, whatever. It would be really good to have everybody tested, but they don't want to. How can that be? Remember the president's executive order to keep the meat plants open? We got our first court ruling today on what that means in practical terms for trying to make American meat processing plants operate in a way that stops infecting hundreds and thousands of those employees at a time. A federal judge in Missouri today ruled that because of the president's executive order, he, the judge, can't require meat plants to follow OSHA and CDC guidelines in order to stay open safely. He can't require them to do it. He has to defer to those agencies themselves. And states can't close these plants down or stop them from reopening if the plants don't follow those guidelines. Oh, and the Trump administration says, through those agencies that it runs, that the plants don't have to follow those guidelines at all. They're just good thoughts. They're nice ideas, but don't worry, we won't hold you to them, not if we believe you're acting in good faith. And so meatpacking plants across the country are operating now while making their own rules, and nobody's holding them to anything. And every day we get hundreds more workers at these plants finding out that they're infected. And yeah, you can lament that meat processing plants are closing down and the meat supply is crimped, and Wendy's stopped selling burgers at a bunch of their restaurants now because they can't get beef, literally. Tyson said in an investor call yesterday, this morning, that the pork supply has been crimped 50%, and that's only going to get worse. You can lament that about the U.S. food supply, but what are you going to do about it? You can't keep these plants open without any workers in them. And if Perry, Iowa, God bless them, if Perry, Iowa is going to have 58% of its workers from its big meat plant test positive, then no, you're not going to be able to keep that plant open because you've infected all your employees with a highly contagious communicable disease that may hospitalize 15% of them and kill a good number of them too. The way you keep the meat plants open is not by ordering them to stay open and then telling the meat companies there's no rules for them to follow. If you do that, what will happen? You will have all of the meat plants close anyway because their workforce will all get sick. If you want Wendy's to have burgers and the pork supply to not be shut off, you actually have to work on this as a public health matter. You actually have to figure out a way. It's not hard to do. You have to only allow these plants to reopen after you have required them to follow really strict rules about how to operate without infecting all of their workers. And that includes mandatory and frequent testing of everybody who comes through the door. And yes, that will be a difficult and expensive thing to do. Making them follow the guidelines that will prevent their employees from all getting infected, making sure they're all testing before people come in. Yeah, that'll be expensive, time-consuming to do. But A, these are pretty rich companies. And B, there aren't that many of these plants. That's why all these plants have so many workers, right? The consolidation of the meat processing industry means that there are a relatively small number of large plants. So fix them. Make them follow really strict rules. Help them do it if they need help. This is not rocket science. Don't just tell them to reopen, you geniuses. Make it possible for them to be open and stay open by operating in such a way that doesn't infect everybody who works there. This is not rocket science. Basic public health concepts. You're not trying to keep the workers from getting infected because you love the workers. We know in the Trump administration that's not your strong suit. You don't have to love the workers. If you just want to keep the meat supply unbroken in this country, you have to keep people who work at meat processing plants alive and at the job, which you can only do if you change the way the plants work. Why don't you get this? But this is our government right now, and they apparently cannot handle concepts even this simple. So we've got from our government, right, I mean, top of my head, right, the disastrous meat plant executive order, which is putting our meat supply more at risk than anything else the federal government has done in this crisis. There's also the FDA decision in the Trump administration to willy-nilly allow anything calling itself a coronavirus antibody test onto the market without any sort of quality control or testing of those tests at all. The FDA has been doing that for weeks. They're only now getting around to telling the hundreds of entities that have put these mostly dodgy tests straight onto the market that actually now, after the fact, now they're going to need to show some data that indicates those tests might work. Oh, good job, Trump administration. In a Friday night news dump late at night, Friday night, the president got rid of the Health and Human Services Inspector General, the one who reported that hospitals were having a hard time getting necessary supplies, including both tests and PPE to protect their staff. Undoubtedly true, helpful report from the Inspector General, so naturally she's got to go. Today, the Washington Post reports on a whistleblower who has come forward to the House Oversight Committee to tell them all about the boy genius volunteer team that presidential son-in-law Jared Kushner put together to be in charge of getting necessary PPE to American hospitals. Well, that team, under Jared's leadership, was excellent, it turns out, at things like expediting requests and paying special attention to tips and questions from conservative TV hosts. But they were not so good at actually getting PPE to health workers in American hospitals. Maybe because, oh my God, this is how the U.S. federal government decided we would tackle this challenge. Quote, the document alleges that the team responsible for PPE had little success in helping the government secure such equipment, in part because none of the team members had significant experience in healthcare or procurement or supply chain operations. In addition, none of Jared's volunteers had relationships with manufacturers or a clear understanding of customs requirements or FDA rules, according both to the complaint and to two senior administration officials who corroborate. So that whistleblower complaint, per the Post's reporting, is supported by corroboration from multiple administration officials. Yeah, they're making lots of good decisions up top these days. Today we learned they're going to disband the coronavirus task force. Since, you know, all better now, let's reopen, everything's fine. They're still, in the Trump administration, as of right now, fighting to take away health insurance from millions of Americans by killing the Affordable Care Act with a Supreme Court case. Seems like an excellent time to take health insurance away from millions of Americans. The part of the Trump administration that oversees nursing homes and long-term care facilities. Right now, what are they working on? They're loosening the rules about what nursing homes need to do when it comes to infection control. Right now, that's what they're working on. They're saying nursing homes should be way more lax when it comes to infection control inside those facilities. Sure, why not? We've learned that the official the president put in charge of public health preparedness and things like building up the national stockpile of stuff we would need in a pandemic. He halted an Obama-era initiative to spend $35 million to build a machine that could produce 1.5 million N95 masks per day. Wouldn't that have been great if the U.S. government had had that? For $35 million, you could have had 1.5 million masks every day, 7 days a week. No, he killed that. So he instead could spend freely on smallpox vaccine supplies from a company he used to work for that appear to have been severely marked up. And now tonight, a new whistleblower complaint, a doozy, from someone who reported to that paragon of Trump administration pandemic preparedness. The new whistleblower is named Dr. Rick Bright. He was a top vaccine official. He was recently demoted within the Trump administration. He has since been sounding the alarm that he was removed from his post for refusing to go along with serious corruption at the highest levels of the Trump administration's epidemic response. And now he has spelled it out in great, excruciating detail. It is hair-curling stuff. That's next.